Pasture syndrome, also known as antiglomerular basement membrane disease, it's an autoimmune condition that affects the kidneys and lungs by causing development of autoantibodies that target the basement membrane. The mainly kidneys and lungs are affected. That's why the patients will have hematuria, proteinuria, oliguria, uremia. In case of lungs, inflammation, hemorrhage, hemoptysis, and dyspnea will be there. The main etiology of this condition is smoking, metal dust, or chemical exposure, cocaine inhalation, various lung infections like influenza, then immune system medications. The pathogenesis and pathophysiology of Goodpasture syndrome. The presence of autoantibodies directed against the glomerular and alveolar basement membrane that contributes to the pathophysiology of Goodpasture syndrome. The antibodies that attack basement cell membrane of kidney and lungs that leads to basement cell membrane damage. So that's why there will be pulmonary hemorrhage, hemoptysis. In case of kidney, there will be hematuria, proteinuria, oliguria. At last, it will lead to respiratory failure and kidney failure. And this condition can be diagnosed by the blood test, complete blood count, then renal function test, pulmonary function test, then anti-GBM, antibody titer, arterial blood gas analysis, chest radiography, and biopsy. Kidney biopsy also helpful. Then the main management. The medicines for Goodpasture syndrome, that is immunosuppressants. There is cyclophosphamide, then prednisolone, then corticosteroids, all this can be given. Okay, immunosuppressants mainly cyclophosphamide, steroid that is prednisolone and methylprednisolone. Monoclonal antibodies also can be given, that is rituximab. Then hemodialysis and plasmapheresis, then intubation is needed in emergency. Usually immunosuppressants drugs are cyclophosphamide, steroids, then monoclonal antibody. That is the main management of the condition. The main complications of Goodpasture syndrome is alveolar hemorrhage, end-stage renal disease or renal failure. For that, kidney transplant is needed. Then pulmonary failure, anemia, hypoxemia. Prevention of Goodpasture syndrome, it is done by patient education, avoiding exposure to environmental stimuli, then quit smoking. Then the person should be educated regarding the signs and symptoms of kidney diseases. Then while taking immunosuppressive drugs, the patient should be informed regarding the problems that may occur later, and periodical tests have to be done. Then the if the person have renal impairment, that should be screened for Goodpasture syndrome. The prognosis of this condition is 5 year survival rate.